So the source of the translation is very, very, very important, so that most of the marketing agency doesn't really know what is a really good source of the content. Even they can do a research, but the translation become a big problem because most of the medical term you don't need the specialization knowledge about of bringing the right and correct translation from English to a local language like in Vietnamese or in any other local language, or even Bengali or Hindi, whatever language you are trying to translate. It needs to be really great, and that really needs some special expertise. Otherwise, the translation will not be aligned, and that can bring up a big problem in terms of your customer when you read a wrong translation. It's called the reading experience. That means when a user is really reading, they really need to have the right reading experience. Otherwise, they will not like to read. They will just simply go away, and they'll feel it's quite boring. It's not interesting. It's not the way flow. So it needs the right infographic. It needs the right videos and all kind of other supporting contents with the right texting and right paragraphing and so on. So we need experience too. And many digital media agencies struggle a lot on this part as well too. It's a quality control process. Every of the articles or every of the content will be generated for your digital media agency, for a healthcare service provider, need to have a really good QC process. With the right QC process, it will be not really great in terms of the community, because you don't want that your opponents find something in wrong or wrong content or low quality content and then use gun on top of you. So that's definitely not a good idea. The same way, if there is a knowledgeable doctor out there and if you see a low quality content, they can read it and they will talk to other doctor. You'll lose more partners, opportunities, and same, they can even hurt your customer with your passion as well. Number 8, the lack of leadership. So most of the healthcare service providers don't have a chief marketing officer, and even they don't have the chief marketing officer who actually, even some of them have chief marketing officer, they don't have the capability as a chief digital marketing officer. And that's why there's a big skill gap in terms of leadership, in terms of building the right strategies, and they have been struggling a lot of hospital, clinics, and even dental service provider as well too. So they're not bringing the right quality to other people's. So they are bringing to quite not wrong informations, or sometimes they bring the not the late information, so which is coming pretty late, and that's not making the digital marketing strategy not successful. So here are my 8 points. If you are a health service provider or any other organization and trying to experience and implement your digital marketing strategies, if you have any challenges, go ahead and comment below. I'd love to give an advice. At the same time, if you have any particular question about all this 8 points, which I just mentioned about it, go ahead and comment below. Love to give an advice. And here we go. You are a healthcare service provider, and now it's so much important in your service for your peoples around you. And this is the way you should be focusing more about building the right brand by using digital media opportunities. So here you go. You got the 8 challenge. Now you can use this challenge to consider to find the right agency to work with you and take your business forward.